Ischemia is defined as inadequate blood supply to a local area due to blockage of the blood vessels supplying the area. Ischemic means that an organ like the heart is not getting enough blood and oxygen. Ischemic heart disease, also called coronary heart disease or coronary artery disease, is a term given to heart problems caused by narrowed heart arteries that supply blood to the heart muscle. Although the narrowing can be caused by a blood clot or by constriction of the blood vessel, most often it is caused by plaque buildup called atherosclerosis. When the blood flow to the heart muscle is completely blocked, the heart muscle cells die, which is termed as heart attack or myocardial infarction. Most people with early CHD do not experience symptoms or limitations of blood flow. However, as the atherosclerosis progresses, especially if left untreated, symptoms may occur. They are most likely to occur during exercise or emotional stress when the demand for the oxygen carried by the blood increases. The discomfort experienced when the heart muscle is deprived of adequate oxygen is called angina pectoris. This is a clinical syndrome characterized by discomfort in the chest, jaw, shoulder, back, or arms that is typically aggravated by exertion or emotional stress and relieved promptly with rest or by taking nitroglycerin. Angina usually occurs in patients with CHD.
Ischemic heart disease, or IHD, is a leading cause of death worldwide. IHD affects around 126 million individuals, which is approximately 1.72% of the world's population. 9 million deaths were caused by IHD globally, and men were commonly affected than women. And incidence typically started in the fourth decade and increased with age. The global prevalence of IHD is rising. It was currently estimated as 1,655 per 100,000 population, and it is expected to exceed 1,845 by the year of 2030. Eastern European countries are sustaining the highest prevalence. Age standardized rates, which remove the effect of the population changes over time, have decreased in many regions. This is Jed Tanura reporting.
Ways to prevent ischemic heart disease or coronary heart disease. First, eat a healthy, balanced diet. A low-fat, high-fiber diet is recommended, which should include plenty of fresh fruits and vegetables, at least 5 portions a day, and the whole grains. You should limit the amount of salt you eat to no more than 6 grams a day, as too much salt will increase your blood pressure. 6 grams of salt is about 1 teaspoonful. You should also avoid food containing saturated fats because these will increase the levels of bad cholesterol in your blood. You should also try to avoid too much sugar in your diet, as this can increase your chances of developing diabetes, which is proven to significantly increase your chances of developing CHD. Second, be more physically active. Combining a healthy diet with regular exercise is the best way of maintaining a healthy weight. Having a healthy weight reduces your chances of developing high blood pressure. Regularly exercise will make your heart and blood circulatory system more efficient, lower your cholesterol level, and also keep your blood pressure at a healthy level. Exercising regularly reduces your risk of having a heart attack. Third, give up smoking. If you smoke, giving up will reduce your risk of developing CHD. Smoking is a major risk factor for developing atherosclerosis, furring of the arteries. It also causes the majority of cases of coronary thrombosis in people under the age of 50. Next would be reduce your alcohol consumption. If you drink, do not exceed the maximum recommended limits. Men and women are advised not to regularly drink more than 14 units a week. Spread your drinking over 3 days or more if you drink as much as 14 units a week. And always avoid binge drinking as this increases the risk of heart attack. Keep your blood pressure under control. You can keep your blood pressure under control by eating a healthy diet, low in saturated fat, exercising regularly, and if needed, taking medicine to lower your blood pressure. Keep your diabetes under control. You have a greater chance of developing CHD if you have diabetes. Being physically active and controlling your weight and blood pressure will help manage your blood sugar level. Lastly, take any prescribed medicine. If you have CHD, you may be prescribed medicine to help relieve your symptoms and stop further problems developing.
Good day everyone, I am Jerry Tingson, currently taking a Bachelor of Science in Medical Laboratory Science at University of Baguio, and I am living a healthy reminder that we are lucky enough of ourselves that we don't have any cardiovascular diseases and we don't have to experience and to try any of it, especially an ischemic heart disease. And I think that it is a must and our responsibility that we should take care of ourselves by means of having a healthy and balanced food diet, by exercising regularly and maintaining our physical fitness, and of course by controlling our vices such as alcohol and smoking consumption. And there are still several ways to prevent it because I believe that at the end of the day, it's better to prevent it than to cure it. Thank you and have a good day.